Hello and welcome. My name is Arlie Dudar. I am a doula practicum student at College of the Rockies in Cranbrook, BC. And this is video number 2 on pain management strategies, 2 of 6 actually, in your labor and birth journey, and how a doula can help you with each one of those. So in video number 1, we talked about what a doula is and what a doula does. And today we're going to talk about some drug-free pain management strategies. If you've already decided that you are okay with an epidural and you're okay with laughing gas and you're okay with whatever the doctor wants to give you, then that's absolutely fine. You can still use a lot of these pain management strategies. Okay, so you may find them useful. Take what you want, leave the rest. That's fine. So we'll talk about 8 to 10 strategies in this video, and we'll talk about how the doula can help with each of them. And before we get started, I want to talk about the pain, fear, tension cycle. So if you've taken a Lamaze class, then you're probably familiar with what I'm talking about, or if you're familiar with the work of Hans Selye, same thing. And I don't have any fancy graphics, so you're just going to have to use your imagination, and I will use my finger to kind of demonstrate this cycle. So when we are in pain, and think of the worst pain you've had in your life, this physical pain sensation in your body, which is just a sensation, is fed by your mind. And so these pain sensations can trigger some thoughts of fear in your mind. You know, you might think, oh my God, what is my body doing? Is it meant to do this? Am I going to die? Is this what's supposed to happen? What if it's not? What if something's going wrong? Is my baby okay? Is my body okay? What if this happens? Now this means that, you know, we're going to do this and we're going to do this and we're going to do this, and my birth plan is totally shot and I'm not going to have the birth plan that I wanted. And so it can trigger all of those thoughts, and then all of those create more tension in your body because that fear builds that tension. So you've got this initial painful sensation, right? And let's say it's a contraction. That triggers some fear. What's happening? Is the baby coming now? How long is it going to be? Oh my God, I'm not ready. How am I going to get to the hospital? And those fears trigger tension. And then that physical tension actually makes you you're in more pain. And then that pain increases, and then those fearful thoughts increase, and then the tension increases, and you see how it can be a cycle, right? So the first step in breaking this the pain, fear, tension cycle is using your mind for good, okay, is knowledge. Knowing what your body is going through, knowing that it is totally natural. And, you know, you can take some prenatal classes that will reinforce that idea, because really, women have been giving birth with all shapes and sizes of pelvises for years, for millions of years. Every mammal on the planet has been giving birth, right? And most of the time it goes fine. And like, really, there are very few issues that come up. Now, our demographics have changed, our population has changed, our culture has changed, yes. But the fundamental principles remain the same way. We are biologically built to give birth. So keep that in mind, that this is what your body is meant to do, okay, through this pain. And when it starts to become all these painful, fearful thoughts in your head, these pain-driven, fearful thoughts, just try to mindfully stop it and say, nope, it's just pain, it'll pass, it's fine, this is what my body is meant to do, and you're breaking that cycle already. Okay, so with that being said, and that kind of out of the way, just remember, your mind is the most powerful tool you have. And we're going to move on to a few tool-free tools that require very, very little, except mostly your brain, and using a little bit of your body and are very minimally disruptive. You can do them with very few resources, and you can do them almost anywhere. Okay, so whether you're giving birth at home or whether you're giving birth in the hospital or a birthing clinic or wherever you happen to be giving birth, all of these things could be used. Okay, and these first three particularly strongly. Okay, so first we have imagery for relaxation. And so the way I like to think about this is think of your happy place. Okay, so for me, my happy place is a tropical beach in the Caribbean. And if I close my eyes, I think of the sun and the blue sky with some fluffy little clouds off in the distance, maybe. I think of the very fine sand between my toes, and I can hear the waves lapping on the beach. I smell the ocean breeze. And I'm there. I'm in that happy place. And that kind of imagery, even though you may not recognize that it actually helps you relax, it does. It helps your body calm down that much more. Okay, so maybe it's a smidgen, but maybe it was up here and now it's down here a little bit. That fear and that pain, right? So your mind is extremely powerful. On the note of imagery, a lot of women have these fears that their bodies are not going to meet the task of vaginally birthing their baby. So they might think, how is my 10-pound baby going to come out of there? I'm not saying all babies are 10 pounds. I'm just using that as an example. Like, how is my baby, whose head is like that big, going to come out of my vagina, which is big? And the thing is that it's a very stretchy organ. It's very stretchy. And you can help it, along the way, along your pregnancy journey, you can help it stretch even more with perineal massage. But a lot of it also has to do with your mind. Because if you are imagining that your vagina will stretch to the circumference of an orange or a grapefruit to pass a baby's body through, it will. It will do that, and it will do it even easier if you are not tense, if your body is relaxed. It's able to relax and stretch that much to pass that baby through. Okay, so not only can you use your mind for imagining your happy place and helping you relax, you can also use it to visually stretch your vagina so that your vagina really does stretch that big so that you get less perineal tears and less chance of an episiotomy. So that's one thing that you can use. It requires nothing but this. It's fantastic. Another tool you can use is music. And so you don't really need a heck of a lot. If you're on a maternity unit and you don't want to be very, very disruptive, or you don't want to blast your music, you can bring a good pair of headphones and your phone or your CD player or your MP3 player or whatever you have. I don't know what people have these days. And bring your favorite relaxing music with you. I say relaxing because typically that's what people want in order to bring their body's vibration down to an earthly level. Okay, so if your thing is the Rolling Stones or the Tragically Hip or Blue Rodeo, then go for it. If that'll help you relax, that's totally fine. What I'm suggesting is more along the lines of classical music. I love good John Williams. I know he's not technically classical, but I like that kind of instrumental classical music, or meditation music, or some kind of nature sounds. So a bubbling brook, maybe, or a wind in the trees, or hearing the rain outside. You can get recordings of all these different things to help you relax and to focus and just get into the mindset of having these rhythmical contractions. Another thing that you could do, especially if it's significant for you culturally or traditionally or spiritually, is sing. So I'm not a particularly good singer, but I would sing and sing through my contractions. And maybe it's out of tune, and maybe it's loud, and maybe it's not making any sense, but it helps, right? And so singing also helps you breathe deeper. It helps get oxygen further down into your lungs, increasing your oxygenation in your blood and increasing your muscle relaxation. Okay, so music and singing are two very effective tools that require minimal supplies. And the last thing is rhythmic breathing. So this is where your doula or your birth partner can help you by guiding you through some rhythmic breathing. A lot of women find that in the earlier parts of their labor, their breathing is slower. It's rhythmic, but it's slow. It's 4 seconds in and 6 seconds out, kind of thing like that. Or, they're taking these long breaths in and long breaths out, whatever way you want to think about it. And then as labor, progresses, their breathing naturally gets faster. And here's the thing, if it gets too fast, you're hyperventilating. And hyperventilating actually makes people more anxious, right? I mean, anybody you've ever seen hyperventilate, or if you've ever hyperventilated, you know that it makes you more anxious. So a doula can help you have those quicker breaths without getting anxious, without hyperventilating. They can keep you on track and say, follow my breath, follow my breathing, model what I'm doing so that you don't hyperventilate, so that more oxygen actually does effectively get to your body. One thing that is kind of like a traditional old school method is for women to hold their breath as they're bearing down and pushing the baby out through the birth canal. The holding the breath thing is not actually that effective. And I say this because, think about, okay, this is super graphic, but I don't care. When you are having a bowel movement, right? A lot of people hold their breath as they bear down to have that bowel movement, but that pressure is actually what can contribute to hemorrhoids. And so it actually makes things worse. And it can basically contribute to people's constipation. And because we're still working with the pelvic floor muscles, the perineal muscles, it's the same principle. If you're holding your breath as you're bearing down, you might get hemorrhoids. It's going to hurt, and it's not going to be very effective. So what I like to imagine is, instead of holding your breath as you're bearing down, as you take a deep breath in and you breathe out, and as you breathe out, you are pushing those pelvic floor muscles down, and you're pushing them open with your out breath. And then you breathe in again, you relax, and you breathe out and you push things down, but you're keeping your breath moving. Okay, so that's just a small side note about breathing. Okay, so we are going to move on. We'll talk about movement. We're going to talk about you moving as a laboring woman. Any kind of movement really helps. And here is where you really want to listen to your body. So if your body is saying, this position isn't working, I need something else, then do it. If it's, walking or something that can be done with a birth partner or a doula is something called slow dancing. It's exactly what it sounds like. And that gentle, slow swaying of the hips, you can't see it, but I'm swaying my hips, actually helps loosen things up, it helps relax, and it does help with pain management because any kind of movement really helps get your blood flowing. Okay, leaning also, so leaning on your birth partner, leaning on your doula helps just sort of relax your body, and it helps to relieve some of the pressure from your back as you're laboring. Also, as a bonus here, any position where you are sitting or standing upright is a benefit to your labor because that gravity actually will help bring baby down, right? Gravity is a real thing. I know some people don't believe it, but it's real, and it will help bring baby out of the uterus into the birth canal. Okay, and so movement, you can use one person for that, or two people, or you can walk with somebody. You can also try going on all fours, and kind of rocking back and forth that way, doing a little bit of like cat-cow position. So in yoga, we call it the cat-cow, or I'm sure there's another name for it, but that's what I call it, is, rounding your back and then pushing your whole body forward while you're still on all fours, and doing that rhythmically with your breath can help you manage your pain, and it can also help if you move with your breath to help your labor progress. So something else that a doula or a birth partner can help with is massage. So massaging certain areas like the lower back, or the the feet or the hands or the shoulders. These are all, they can all get really, really tense, right? Our hands are an excellent distraction for the woman, and they may be sore. The back, especially up here, can get quite sore, the shoulder muscles. So massaging that can help relieve some tension and manage some pain. And then the lower back as well. Doing things like gentle pressing, or kind of doing like a gentle little wiggle with the hips can help kind of, again, loosen up your hips and manage that pain, get things moving. And this is something that the doula, like your partner can do this too, your birth partner, but your doula can also help direct the birth partner and say, let's try something else. Can you massage her feet? I'm going to massage her back. I'm going to do this. Massage her feet in these long strokes and avoid these areas, or, massage her hands, a particular point that helps, according to acupressure, is between the finger and the thumb, right there. If you push down on that, some people find that really beneficial to relieve some pain. Okay, so a small note about massage and about just pain management in general is that sometimes it'll work and sometimes it won't, but it doesn't necessarily mean that idea is scrapped, right? So touch can be very, very therapeutic, but it may not always be therapeutic. So, sorry, I lost my train of thought. Yes, touch will be therapeutic, but it is up to the laboring woman to say, no, I don't like that. No, I don't want that. No, I want something else, or do it this way, because it's your body, and ultimately your birthing team wants to promote, positive experience for you as the woman doing the hardest work. So that's just a side note. Speak up for what you want. Nobody's going to be offended. Okay. Another thing that can be done is using hot or cold packs and hot or cold therapy. So applying heat pack to the lower back can help relax those muscles, It can, you can do hot or cold alternating as is desired. And I wouldn't recommend any more than about 20 minutes for each one, just because potential skin damage. And here I'd like to mention that you can make hot or cold packs out of almost anything. So if you're at home, you have all the luxuries of home. But if you're in the hospital, you have, fewer resources, especially now in these times of COVID. A lot of places have concerns about germs. And so they don't let a lot of patients into, the ice machine room, or they don't let them use the microwave or whatever for heating things up or getting ice. So that's something to keep in mind with your facility that you're using. Just inquire if you're able to use the ice machine, if you're able to use the microwave, and if you're not, to have a backup plan. Okay, so in a pinch, if you're at the hospital, your doula can make up, or your birth partner can make up a hot pack, or you can ask the nurse to make up a hot pack out of something as easy as a disposable brief insert. They're like liners, basically, these disposable liners that we have. And you pour hot water on it and wrap it up, and instant hot pack. Or putting ice cubes into a plastic bag, wrapping that in a towel, instant cold pack. And, keep that in mind. You can bring in, some places you can bring in electric blankets, others you can't. It's seen as kind of a safety hazard, same with hot water bottles in hospitals. So maybe inquire about that ahead of time and see if you're allowed to. At home, of course, you can use whatever you want for hot packs or cold packs. Now, again, try 20 minutes on, 20 minutes off, okay? 20 minutes of cold, 20 minutes of hot kind of thing. And then in between, try other things like moving around or, singing or rhythmic breathing, things like that. Small side note, don't use hot or cold packs on a person who's had an epidural on their numbed area. If it's done properly, they shouldn't be able to feel anything really below the waist. And because of this, they won't be able to tell you if it's enough. So the laboring woman won't be able to say it's too hot or it's too cold. And you really have to keep an eye on the skin in that case. Okay, so try not to use hot or cold therapy like that on numbed areas. All right, another thing, speaking of hot-cold therapy, another thing that you could do if you are in a place that it is luxurious enough to have is showers or baths. So if you're at home, use the shower or the bath to your heart's content. If you are in a hospital, I hope that you have access to one of those things. They can really, really help relieve tension. And your doula or your birth partner can actually get into the shower or the bath with you. You can bring in like a little stool into the shower if you want to just sit there and let the hot water rain down on your back. About showers and baths, a shower is more advised if your water's already broken. Because having a bath, even though there's a smaller chance, having a bath, once your water's broken, introduces water into the vaginal canal, which is not sterile, and then also potentially introduces water into the uterus, which is sterile, which can cause infection, right? And also that's a sudden temperature change for your baby, and you don't want that. Straightforward. And we talked about movement already, but what I'd also like to bring up is position changes. So again, listen to your body and what your body wants. If your body says, I need to go on all fours, I need to use a birthing ball, you can use a birthing ball if you have one to really lean on to give you some, relief from that pain. You can also use a birthing ball to just sit on with your legs kind of open a little bit, and this helps your hips open up. Side note about birthing balls, if you're the kind of person who likes to watch TV in the evenings with your partner, which I am because I just, I like evening shows, using a birthing ball during your pregnancy and sitting on that birthing ball as much as possible really helps facilitate the cephalic position for baby. So it helps baby turn into a position where it is head first, which will enable easier birth for you. And this is much more conducive. Sitting on the birth ball is much more conducive to that shift with baby than you sitting on the couch, which when you think about it, sitting on the couch is very similar to laying in a hospital bed, right? You're laying back and your hips are actually in the narrowest position when you're on your back. So I don't know if I mentioned this, but when you're on your back, you can actually feel, if you try to measure between the two tops of your hip points across your middle, you can measure how narrow your hip area is. And then you can actually feel as you change positions. So you sit up. Sorry, I'm looking around because I'm thinking about this. If you sit up or you lean forward or you go on all fours, you can feel those hips open up. So that gap actually gets bigger. So your hips are changing positions. So birthing balls can really help facilitate this. And certain positions, laying on your back, really don't facilitate it. If you're laying on your side, particularly your left side, that helps baby get into a good position. Or if you're kind of, squatting is good, or kind of sitting on your feet, or, sitting cross-legged if you can manage that. Those are all really good positions for baby to open up. Okay? So I think we've talked about everything, and I've taken up enough of your time. So we'll close here. And the biggest thing I want to bring back is that I just want to reinforce before we go is to listen to your body. It knows what to do. Okay, and it is smart. It's been doing this for generations, the human body. And not only to listen to your body, but also to use your mind for good. Okay, so your brain is very powerful. Your mind has so much knowledge and so much influence on your body. And knowing that, use it for good. And don't let that fear get in the way. Okay, we'll see you next time. We are going to talk about birth plans.